We want to get rid of the cancer.
That's great news.
We had another patient I just wanted to talk about this week, and she's a woman, of course, she is a woman, and she came in with a history of lymphoma that was spread to several sites, and she got a new PET scan, which showed that the cancer had spread to the lumbar spine, and so she was here, her daughter from Louisiana was here, and her son were here. So very loving family, eager to take care of their mother.
That's sweet.
And it was really beautiful that the family came together for the mother and for the second opinion. And we went over the data, and we had our staff get the pathology and the reports. Often patients say, oh, let me speak to my doctor about a second opinion. Well, the whole idea about a second opinion is to see another doctor and get fresh eyes and a fresh view on the situation. So we got the pathology. I had even dictated my notes, and we got the pathology, and it came back carcinoma, not lymphoma.
Oh, wow.
So this woman's being treated for 6 months, being told she has lymphoma, and she doesn't have lymphoma.
Oh, my goodness. How could somebody screw that up?
So I didn't say it's screw up, but I'm just saying that, the whole idea is when someone comes to us, we try to go through all the data independently. We try to give the patients copies of the reports so they've got their own reports. They can read them themselves.
Yeah.
I always tell patients they should make a notebook or a binder with all your reports so you have it over the years, so you know what you have, when you had it, because as time goes on, it sometimes gets confusing even for the patient. And for a new doctor to get on, it's great to be able to have access. So we got the path. So the pathology was different. Then we got the PET scan report from elsewhere, and it showed the cancer had traveled to the spine.
Oh, no.
To the lumbar spine, L2. And
that's dangerous, huh?
Yeah, it's very dangerous. And so we got an MRI, like we were talking about a minute ago.
It's better for the spine, yeah.
Which is better for the spine. We got the MRI, and guess what?
What?
No cancer there.
What?
So she walked out of the office with a different diagnosis and no cancer where she thought she had the cancer.
Wow.
So, and she never had the cancer in the spine. So the beauty of this lesson, and I think we learn something with every interaction that we have, is that second opinions are useful. It's good to let another doctor look at something totally independently.
Yeah.
If you go back to your first doctor, you're probably going to get the same answer. And it's great to go back to your first doctor. I tell you should go back to your doctor.
Yeah.
But also, if you have questions, go to get a second opinion, because this woman was going to go through different therapy.
Yeah.
She had great concerns. The family would have believed for the rest of their lives that their mother had lymphoma.
Yeah.
So I'd sit down with the family in 20 years and ask, what did your mother have? And they'd say probably lymphoma, which wasn't correct.
Yeah. Wow.
We do have a caller. We're getting towards the end of the hour, but we're happy to speak to Paul from Nassau. Hi, Paul. How are you?
Good morning. How are you?
Fine, thank God.
Basically, I fit in that category of lower sperm count with higher risk of cancer. What preventative things can be done to minimize my risk, if any?
Well, it's not lower sperm count. It's no sperm.
I have very low sperm.
Okay, so what's your age?
I am 46.
All right. Well, first of all, that category was mainly younger men under 30. And number one. Number two, it was for men with no sperm, not low sperm. What would be the best thing is to go get checked out. Take this information to your doctors. Tell them you're concerned about it, that there's a report that men with no sperm, especially young men, have much higher rates of cancer. So it doesn't affect every man, and probably, hopefully you're not in this category, but it is something to be evaluated about.
Understood.
Okay?
Thank you.
Thank you very much, and call anytime. So it's interesting that people are listening, whether you believe it or not.
Yeah, they sure are.
We had another interesting patient this week,
Uh-huh.
speaking about a young man, the same age as the man that just called, and he had esophageal cancer at age 40.
Okay.
He was married with kid, so he has a child, so he's not in the no sperm category, and had surgery only for esophageal cancer. So very young to have this kind of cancer.
Yeah.
He had surgery only.
Okay.
He was operated through the right chest.
Well,
and,
so how does that work? Do they have to graft something in there? How do you
no,
swallow
you pull
food?
you pull up the stomach. You can pull up the stomach through into the chest, so you have continuity, so you can swallow.
Oh,
That's
really?
what's usually done.
So the esophagus just gets shorter.
Right.
Oof.
So he had no follow-up treatment after the surgery,
Okay.
and then the cancer came back,
Well, sure.
and then 4 years later he had some chemotherapy, never had radiation, and he came to me this week with severe, excruciating pain on his right side.
Uh-oh.
And we did a PET scan on him and actually found incredible that this cancer had recurred, but it recurred and like eaten through the entire rib from almost the start to the finish,
Oh, my
which is something
God.
we very rarely see.
That sounds frightening.
And he had had multiple surgeries through that right side. So you wonder if the surgery spread the cancer to the rib, number one. He was having severe pain, number two. 3, we got him some medication to start some relief immediately. And he had standard radiation elsewhere, which didn't work. So we're going to be doing radiosurgery on him. Radiosurgery is non-invasive treatment where we aim beams from many angles non-invasively with no cutting and no bleeding to hit the cancer. And we have a pretty good success rate. It's not perfect, but a pretty good success rate in relieving his pain and suffering.
You think he's going to keep that rib?
He'll keep the rib. Most likely with us, the cancer will go away and the rib will heal up.
Excellent.
So that's what most likely will happen.
And the pain will go away, too, as a result.
We want that pain to go away off of medicines. We're dedicating this show to my son who's driving across the country, so hopefully you're getting out of the Sierra Madres now. If you have questions during the week, please call us at 212-CHOICES, 212-CHOICES. We have a free booklet and DVD if you want, or you want to ask questions or come in, please feel free to call that number, 212-CHOICES. And I want to thank Daryush, who's here, my co-host, Reggie and Ed, who've done the technical work. Thank you very much, and join us next week, and join us tonight also at 9 o'clock on WOR.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
The proceeding was a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed.